Hello there, everybody. Here's my second installment of my trying to shorten up the video to say hello to you and that we miss you. My first video I talked about flossing and it went a little long. That one was like 8 minutes, so hopefully this will be a little bit shorter. We just want to let you know that we're thinking about you guys. We miss you. You guys are like family to us, and we really can't wait to see you again. So today I just wanted to talk about flossing. May as well don my gloves, right? Put on the protective gear. Hopefully you guys are doing this as well at home because you have to stay safe. So when you put your mask on, you have that. Make sure you get a seal underneath and that it's sealed around your nose. Whether you wear a homemade material mask, you want everything closed up. Even if you're wearing a bandana or something, try to make, because we're preventing droplets from getting on our face, getting near our eyes and all that. So you see us like this normally. We'll probably have some new addition. Always have some kind of face shield like this. I won't use it now, but things will probably be a little different normal the next time you come in. So anyway, I want to talk about flossing today. Flossing cleans in between your teeth where your brush will not reach. Absolutely, the brush will not reach in between your teeth. So you have to do something. So there are a lot of interdental aids out there. The first one is flossing. You want to get a piece of floss, kind of about 18 inches long. And so many of us tend to wrap up our index finger. That's the finger that we need to use. And we don't want to do that. So we want to wrap it around our middle fingers 2 or 3 times around our middle fingers. Let the long piece dangle. And then that way, this is like an anchor, and you can use your first 2 fingers to get everywhere. So the one thing that you want to do when you floss, most of us go in and out, flick in, flick out. That doesn't do a darn thing. So what you want to do is you take it down, you kind of seesaw it down in between your teeth, you get it down along the bottom, and then you need to wrap it around one side of one tooth. And then you go up and down the full side of the tooth. You don't just go back and forth because that only gets one spot. You want to go up and down the full side. Then you wrap it around the other side of the other tooth, and you do the same thing. I don't know if I should have gotten something a little higher, but this kind of can show you. You go down in between the teeth, you wrap it around one side of one tooth, go up and down, and then wrap it around the other side and do the other side. Now you do want to go down under your gums as far as you can without it hurting, but keeping it wrapped around. If you're straight like this and you go straight into the gums, you're going to cut your gums and create some floss cuts. So you want to make sure, I have to tell myself every time I floss, wrap the floss, all these years. The other place you want to remember is the very back side of the molars, because we don't really think about them, the bacteria getting back there, but it really does. So, okay, that's the flossing. Now, there are a few other interdental aids. One is the Proxa brush, which is like a little actual brush. And this is great. You'll be shocked what comes out on this, even after you brushed and flossed. So what you want to do is you want to just take this in between your teeth and just go in and out like this. Now, the idea is just to disrupt the bacterial growth. So you go in there, you disrupt the growth, then you go to the next spot, disrupt the growth. Now, we only like these interdental aids for the back teeth. You have room generally for them. In the front, you know how the gum comes down to a point, fills in the space in between your teeth. You want to keep it that way. If you're trying to shove something in between your teeth where there's not room, that will flatten off or blunt those points, and we don't want that. So there's that size, the small size. If you've had some bone loss around your back teeth, you might be able to fit the bigger size in there. This guy has periodontal disease pretty bad, so it'll fit very easily in there. So you just do the same thing. Just go in and out a few times and just do all the back teeth. So that is a great aid. They also have these little rubber points. So same size, the green and the blue, and it's the same thing, and you want to keep it to the back teeth as well. Now if you have a bridge, you will, please don't forget to use your floss threader. So this is like a needle and a thread, and you just put the floss through the eye of the needle, and then now you have a way to get down underneath, in between two crowns that are joined, or a bridge where there's a real tooth, and a fake tooth in the middle. You take this underneath there, pull it through, and now you can floss the tooth normally. So one more thing that we have is the rubber tip. Now, the patients that I have that use this rubber tip, it's amazing how healthy their gums are. So this is a really great tool. The way you use this is you can do it in a couple of different ways. You want to take it and use the point, and you can just take it and just kind of trace it around the tooth, in and out, up and around, up and around. And what that does is that just disrupts the bacterial growth. So you just want to do that. The other way to use it that we've seen some really great, especially a tooth that has had a root canal where there's no nutrition to that tooth, what you do here is you just take it, put the point here, and just kind of massage for like 5 seconds. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. So this is really good to stimulate the blood flow in the area to provide nutrition to the tooth. So that's an awesome tool. Now, I wanted to keep this video short. It's already 7 minutes. I wanted to talk about the water pick, but I guess I'm going to have to do that on the next video. So if you want all of it together, watch my 23-minute video. So, okay, just so you know that Dr. Downey is here for emergencies. If you have any kind of pain or swelling or anything, please give us a call. Someone is here every single day. We're trying to cover the phones, and just know we miss you. Okay, talk to you soon. Bye.